Welcome to the California Healthy Places Index, a tool designed and produced by the Public Health Alliance of Southern California. This interactive, online mapping application is feature-packed, and this video will provide a full overview of everything it has to offer. Before diving into the map, I'd like to provide some history and context for this tool. You might have heard of an earlier version we produced called the Health Disadvantage Index. With this new and improved version, we paid very close attention to reframing the data, the visualization, and the narrative information that accompanies the map, utilizing an intentional and positive asset-based frame. That starts with a new and more approachable name, the Healthy Places Index, which reflects our goal for this tool to be representative of community conditions, not individual behaviors, in neighborhoods across California. The color scheme, used here across the map, is also something we wanted to be thoughtful about when designing the Healthy Places Index. We opted to use shades of blues and greens to denote the range of healthy community conditions, from dark green, representing the areas with the most healthy community conditions, along the spectrum from light green to light blue, and finally dark blue, indicating areas with less healthy conditions. At the Alliance, we believe it's important to avoid the use of reds or oranges on the map, particularly in light of historic redlining, which negated economic opportunities for people of color, but also because there may be an implicit association between shades of red or orange with warnings, stoplights, hotspots, or other negative imagery. Not surprisingly, communities that have faced significant divestment over time have fewer healthy community conditions today. Yet we know that every community has many factors at play, and regardless of the shade of blue or green on the map, every community has assets. We think the Healthy Places Index is uniquely designed to celebrate and recognize the health opportunities present in neighborhoods across California. With that in mind, let's dive into the map for a tour. When the map first loads, you'll see the entire state of California, covered in colorful squares. These squares represent groups of census tracts. To make sense of what you're seeing, take a look at the box in the upper right-hand corner. Here. The first item tells you what you're viewing. In this case, the California Healthy Places Index. Just below the title is a button that indicates what geography you're viewing. Right now, we're looking at census tracts. Below that is the legend, indicating what score percentile each color on the map corresponds with. As noted before, areas of dark and light blue indicate fewer healthy community conditions, where areas of light and dark green represent places with more healthy community conditions. This box and the legend will change as we interact with the map. If you're ever not quite sure about what's shown on the screen, simply return here to be reminded. Now, let's take a look at a specific census tract and learn more about its community conditions. We'll jump to Santa Ana in Orange County. When you select a tract, this Details panel on the left will open. The first item is the HPI score, followed by a visualization of where this score falls within the 4 quartiles, from least healthy conditions to most healthy conditions. There is also an interpretation sentence to help you make sense of the score. We've also included some general information about the tract, including what zip code it falls in, as well as the population that lives here. Below that are 8 policy action areas, with many versions of the score visualizations indicating the percentile rank. We can also drill down in each policy action area. Let's take a look at education, for example. When you click this arrow, more information is revealed, including an interpretation sentence, plus a list of every indicator contained within this policy action area and their percentile rank. Immediately, you can begin to see the nuance that the Healthy Places Index affords. While the overall score in this tract may indicate fewer healthy conditions, it's not uniform. There are indicators, such as high school and preschool enrollment, that this community is doing really well on. You are quickly able to identify the positive assets in a neighborhood as well as those conditions in need of improvement, the health opportunities of this community. If you see an indicator of interest, such as bachelor's education or higher, you can click this arrow to get more information. As with the overall HPI score, you'll get a visualization and interpretation of this indicator's percentile rank in this census tract, as well as a host of specific details about this indicator, including a straightforward definition, the indicator's value, and here how this indicator connects to health. This connection to health text provides important context in simple language about the linkage between this indicator and health outcomes. Our goal with the Healthy Places Index is to make it easy to take data and turn it into action, giving you the tools to improve your community's health. That's where this section, Policy Actions to Address This Indicator, comes in. For each of the Healthy Places Index indicators, we've provided detailed policy guides that offer specific, actionable, and relevant policy solutions. When you click on any of these links, you are redirected to our website, dropped into the section of the full policy guide that corresponds with this heading. For each policy, we provide a short description, examples of the policy in action, and links to reputable resources for detailed guidance on implementation, toolkits, templates, and in some cases, funding opportunities. While we're here, let's hover over one of these little icons. These are our benefit buttons, flagging that this policy has extra benefits, in this case economic, but there are also a host of other icons, including those for policies that benefit equity, the environment, quality of life, and many more. We're excited to offer this detailed complementary suite of policy solutions alongside the wealth of data in the HPI. Returning to the map, you'll see that below the policy actions, we provide detailed information about this indicator, including the technical definition, as well as the data source and year. You can return to the policy action area and overall HPI score by clicking the back button here. You can also return to the full map view by clicking the X here. Finally, let's zoom back out to the state level by clicking this icon here. The Healthy Places Index isn't only available at the census tract level. Now, you can easily switch between geographies using the geography switcher indicated here. Note that in addition to common geographies like cities and counties, you can also view the Healthy Places Index at the level of various state and federal legislative districts, as well as Oshkosh Medical Service study areas, elementary school districts, and more. To switch geographies, simply select it from the list. I'll choose cities. As we zoom into the map, you'll begin to see the cities resolve. You can always return to the census tract view in the same way by selecting census tracts from the list. Now let's explore some of the other functions the Healthy Places Index has to offer. You can use the rank function here to quickly identify the highest and lowest ranked tracts in your area of interest. Simply type in the geography you're interested in. I'll use Modesto, for example. The map will zoom to the location and automatically pull up a list of every census tract in the city. By default, it sorts the census tracts from lowest to highest score. You can change that by pressing this icon next to percentile here. It will now list and highlight the top-ranked census tracts. You can see which tract number corresponds with each tract by hovering over it in the list. A thin orange outline indicates the tract selected. This rank function is a useful tool for finding high and low ranked problem areas in a community and might help answer questions such as where should we direct resources, where is most at risk, and what can we learn about the place with the highest rank, and how can that be applied to places ranked much lower? Let's clear this ranking for now so I can demonstrate the next function, pooling. If your project area or jurisdiction is not represented in our selection of geographies, here, you can use the pool function to create your own custom aggregations, or pools, of geographies to suit your needs. To do this, select the pool function, then simply click on the census tracts that you want to add to your pool, like so. If you want to add a large group of tracts at once, click this icon here and use it to draw a box around the tracts you want to select. Click the icon again to go back to selecting single tracts. You can also remove tracts from your pool by clicking them again, like this, or by selecting the X next to the tract number in the list here. Once you're satisfied with your selection, click the Pool Census Tracts button. Notice that your pooled tracts now have a single color and a crosshatched background. A new HPI score has been calculated for this group of tracts. You can click on the pool itself to get more information. Here, you'll see the new HPI score for the pool, and you can drill down into each policy action area and indicator in the same way as viewing a single tract, with all the policy action area and indicator scores calculated for your custom pool. We think this function could be especially useful for grant applications, where you might need to generate an overall HPI score for a project area, or to get an estimate of an individual indicator in your custom geography, such as the employed population or access to automobiles. Your custom pool can also be used with the rank function to quickly identify how it compares to other nearby tracts. To clear your pooled tracts, simply return to the pool function here, click on this arrow, and select the Remove Pool button. Let's take a look at another city. I'll pull up Reading. Now, let's say you found some useful information here, such as about this particular census tract, and you'd like to take that in a nicely formatted, ready-to-share package. With our customizable report tool, accessible here, you can easily communicate your findings. To begin, you can customize the report by adding your own introductory text here. We've provided some contextual information by default, but you're welcome to add, modify, or remove it as needed. You can also co-brand the report with your name or the name of an organization. And if there are specific indicators that you'd like to include in the report, you can select them here. For each indicator selected, the report will include the definition, the value for the selected geography, data source and year, and general policy actions that can be used to improve it. At the very bottom, you can provide some additional or wrap-up text in this box here. When you're ready, click Download Report. Opening the report, you'll see a mini HPI dashboard with the overall HPI score, visualizations for each policy action area, as well as a map snapshot of your area of interest. On the second page, you'll receive a larger map snapshot. The remaining pages contain your introductory and closing text, as well as detailed information on any indicator you selected to include. Returning to the map, you can also quickly export the data in CSV format for your use via the Data tab. Data that you download here will only be for the entire state, and you have the choice to select all indicators or only indicators of interest. If you want to go even deeper into the tool and the data we have available, you can use the View Indicators feature to switch between viewing the Healthy Places Index, individual HPI indicators, and an array of useful decision support layers. On this tab, you can view individual HPI indicators organized by their policy action area. On this tab, you can access our decision support layers. Among the data available, we've included health outcome and risk behavior data for the most populous cities in California, comprehensive climate change and climate change-related indicators, including climate and sea level rise projections, populations at increased risk from climate change, and adaptive capacity measures such as impervious surface cover in households with air conditioning. We've also provided decennial census data on a variety of race ethnicities available here. If you're ever unsure what a specific layer contains, you can get more information by clicking the arrow here. You can then return to the layer list by pressing the back button. Now, if you'd like to load a layer onto the map, simply click View on Map. Note that the legend now changes, indicating that impervious surface cover is now displayed. You can then click on a census tract to get a full complement of information similar to the HPI indicator detail view. You can remove the layer by clicking Remove from Map here, or you can also use the Clear button here. Whenever you remove a layer, the Healthy Places Index is displayed. This ability to view supplementary data layers is useful for finding health outcome problem areas or areas that increase risk from climate change and learn more about the community conditions on the ground. As we hear from users about what layers are useful for their work, we plan to continue building out this list, adding layers to respond to interest. You can also use the pool and rank functions with individual HPI indicators or decision support layers, as well as the function I'll demonstrate next, Custom Score. Sometimes, you may need more information than what the Healthy Places Index, individual indicators, or decision support layers can provide alone. We designed the Custom Score function, available here, to address that. Here, you can combine individual HPI indicators plus decision support layers to create a custom score that specifically reflects your needs and priorities. You might want to create a custom score to quickly target areas with overlapping risk factors, or perhaps expand our HPI to include indicators that are important to your specific area of work. Before we build a custom score, it is important to note that any score generated here is not weighted, unlike the Healthy Places Index. In the HPI, each policy action area is weighted to maximize its association with life expectancy at birth, the factor that makes the Healthy Places Index so unique and predictive of community health. To create a custom score, simply select a complement of indicators. You can select HPI indicators, decision support layers, or a combination of both. You'll see that as I add indicators, the legend changes to identify what's included in the custom score. If you want to remove an indicator, you can click the X next to its name in the legend, or uncheck the box in the left-hand panel. When you're happy with your custom score, you can explore the map or use the other features like pool, rank, and reporting. Let's clear the custom score for now and zoom back out to the state level. The last function I'll show you is our data upload feature, available here. In the event that we don't have all the layers you need, we've built in a data upload function that allows you to upload your own data and use it in conjunction with our available layers, including the Healthy Places Index. To do so, select Upload Your Own Data and follow the prompts on the screen. The tool accepts CSV files, as well as shapefiles and point data, which means you can upload files that include the location of hospitals, for example, or other services key to your work. The uploaded data is for reference only and will be displayed as an overlay on the map. Normally, any data you upload here is visible only to you and will be removed once you navigate away from the map or close your browser. For a small fee, we also offer a user account function, accessible here. A user account gives you the ability to save uploaded layers and access them at any time, even after you leave the map or close your browser window. This is a great resource if you have a lot of data you want to view on our map, or if you have a project you expect will take longer than one session to complete. And with that, you've seen all of the major features of the California Healthy Places Index map. Throughout this video, you learned how to navigate the map and switch geographies, Access the HPI, Policy Action Area, and Individual Indicator Percentile Rankings. View our comprehensive policy guides. Use the rank function to compare census tracts in your community. Use the pool function to create your own custom aggregations of census tracts. Create an HPI report packed with map snapshots, score summaries, and actionable information. View individual HPI indicators and our decision support layers. Create a custom score, and upload your own data. To wrap up, let's take a quick tour of the Healthy Places Index website, where you can get more information on the HPI, including updates, resources, tutorials, and more. To access the HPI website, go directly to healthyplacesindex.org. Our homepage features quick links to the HPI map under Explore Your Community, and more information about who's using the HPI here. We'd also love to hear how you're using the HPI so we can develop new tools and resources to support your work. Up to the menu bar, you can quickly jump to the HPI map through this link, and you can access simple, bite-sized video tutorials for the map on our Get Started page. Here you can see that we have videos for every function the map has to offer, so if you missed a detail in the demo, you can check out the tutorials here as a refresher. You can also access all of our complete policy guides through this Policy Actions link here. These are the same guides linked to from the map, but you can easily access all of them through this index. We've organized them by Policy Action Area. Clicking through to a guide, you'll see that we provide important contextual information in addition to the policy actions accessible by scrolling down. We've also compiled communication tools, resources, and recommendations on how the HPI can be used under the Use HPI in Your Work link. You can access the audience briefs here, as well as learn how the HPI is already being used, and how the Public Health Alliance can help you use the HPI under Export Services. If you'd like general information about the HPI, including what indicators are used, related projects, and more, you're likely to find that on our About page. And if you have specific questions, there's a good chance we've already answered it on our FAQ page. Lastly, if you're technically minded or are interested in the methodology behind the Healthy Places Index, you can access that on our Data and Reports page. Our technical report is available up front, and data downloads, including the HPI master file, individual indicators, decision support layers, and the HPI map shapefile are freely available for you to use. Our website will always have the latest news, updates, and resources for the HPI, so please check back often. Thank you for watching. This concludes the website tour and feature demo of the California Healthy Places Index. We encourage you to try it out for yourself at map.healthyplacesindex.org and visit us on the web at healthyplacesindex.org.